Welcome everyone. I want to show how pharmacists think about rational pharmacotherapy. I hope it's not a new stuff that I'm a pharmacist, but let's see what's my vision. I want to see educated patients in the world. And how do I want to achieve it? To be a core character in internationally recognized patient education programs. But rational pharmacotherapy is not just about educating patients. It has a lot of aspects. And I should mention that my first two topics is rather about an add-on question. And my second topic is about how to avoid some medication by education. So, let's approach in this way. Nabiximols is a strange medication. It has many questions around. We have many questions around it. But for first, it was a great deal that whether it's good in spasticity of multiple sclerosis. And I should highlight the fact that the studies which were concerning about it is really heterogeneous. But what should be highlighted that all of them point to one direction, that nabiximols have clear effect on spasticity of multiple sclerosis. So, we already sent it to a journal and got the first revision, and we have already sent it back for them. And we're waiting for the answer. My second topic, my second project is rather about an off-label utilization of nabiximols. Why, it's a question? Because multiple sclerosis is not just about spasticity. It has many symptoms that need some kind of treatment. Because a patient cannot live with severe depression, with urinary dysfunction, with sleep disorders. It's really annoying. So, in this question, if we directly treat all of them, we need new and new medications. But here comes nabiximols. Because in many trials, they reported further effect than just spasticity. And it would be a really nice state if we could just hit two flies with one slap. So, our clinical question is, does nabiximols improve multiple sclerosis-associated symptoms further than spasticity and pain, which were the original indication? And we believe, yes, it can be. And if we are right, then we can broaden the indication spectrum of nabiximols. Where we are now, we achieved already the data extraction, which could be stated as good, and let's go to the statistician. But again, we met the fact that the clinical trials are so heterogeneous that we have to revise the data and clear it one more time. My third topic, my third project, and technically my second topic, is about breastfeeding devices. Technically about over-the-counter medication. Why? It's a great deal, because pharmacotherapy of lactating women is challenging. Medicines might pose danger to the baby or decrease breast milk. Any of them is a problem. But we could state, okay, avoid any kind of medication. Can we do it? No, because undue rejection of medicines is also really disadvantageous for the mother and for the baby as well. But if it's in the hand of a medical doctor, we could say that it's the best situation. But what about over-the-counter medication? Especially if the mother buys this drug from the internet. Where is the medical supervision for this problem. Because we know that the information from the internet is really heterogeneous, if I can say it. So what we want to really achieve is to develop a multimedia platform for patient education of lactating women. But for this, we want to achieve the highest kind of knowledge translation. So first, we have to assess how knowledge translation works. We have 4 interventions, namely video content, podcast, written content, and illustration. And our primary outcome is knowledge translation efficacy. Our hypothesis is that there is difference between the different media in knowledge translation, and we believe illustration is the best way for this education. But whether or not we are right, we will have a tool or set of tools that can be used for education, and this could be the best way how to teach these women. What we have now? We are ready with the pilot to the pilot phase, and we have further materials as well. But let's see first the pilot. We have the written content. We have podcasts as well. We have a really nice video content and also an illustration for this topic. In every single case, we try to make as homogeneous the information as we can. So first, we write the material. Second, we asked specialists to do the materials. So this is how we could compare these ways of knowledge translation. Where am I now? So I have submitted my first reviewed first project. I have extracted the data from the second meta-analysis, and now I have preliminary materials for my clinical study, and I've applied for funding to find some money for these materials. And I want to thank you for your attention by a quote from Albert Szent-Györgyi. Science is based on the experience that nature answers intelligent questions intelligently. So if she is silent, there may be something wrong about the question. Thank you.
If I can ask, this may see, this seems to be a little out of the science, but I think very, very important for all of us. I mean, you are the first one actually where I saw that you are applying for a grant. I mean, to keep your science running. Although I think this is very important for all of you, because at a certain point, I mean, you have to find your self-financing on this. And actually, we also had a discussion about this with the tutors in one of our meetings, that they were asking about how to handle this. And this is not an easy thing. I mean, everybody has to find his or her own way. So how did you manage this? What did you do? And what are your expectations?
So it's the STIA, and it was the advice of Peter that I first overlooked. And second, I realized that it's definitely what I needed for this study, and this is why I just...
Yeah, I know what STIA is, but probably not the other guys. So.
But technically, it was a general message for the translational medicine that Semmelweis University had...
Either grants.
Yes, and so it was...
Starting grants.
It can highly help on on students who do not have direct money for their clinical trial. And the maximum was, if I remember well, 6 or 7 million forints, which is nice if you really want to do your clinical trial to achieve a good level. Also, the media as it is, to construct it, needs money, because who works with it also some kind of author or some kind of, yeah, they need money, technically. And this is why I really needed to apply. What I expect, I have high hopes, because what else could I have?
So you mentioned that you wanted to solve the problem of the heterogeneity of the information on the internet and make it more homogeneous. Could you please explain what does that mean in context?
So what do I really want to do? I want to make technically a homepage where mothers can achieve direct information if they have some kind of disorder like fever or pain or cough. To have some advices, what to choose, what kind of medication, what to avoid. This is technically, if I can say it in short.